Our government, we believe that an effective healthcare system really depends on people like you. Strong community-based leadership, both at the hospital, through the foundations and the auxiliaries. And this will really be part of how I view healthcare delivery right across our province. I have personally, as I said to the people in Cape Breton, I have no interest in developing a Halifax-centered only healthcare system. We must be strong in every part of Nova Scotia and be able to deliver as much as we can here presently and certainly in the future. And I know how you are critical to what has taken place, as the Premier said, around the fundraising, but what you do in terms of services and support to this community and surrounding communities. And this hospital is a really important hub here for you. And I know from what I've experienced through my time in public office and living in my own community of Kingston, Nova Scotia in the Valley, and what we're seeing more and more is that the actual improvements you're going to see here is going to be an important recruitment tool. The good doctor who has labored long and hard in your community, that style of a solo practice is really disappearing. And it will be this collaborative center that will attract the next generation of doctors. And that's why this announcement today, because the current design, the layout, and the age does really not support today's model of health service delivery. So as we talk about changing and improving healthcare, the conversation also needs to include what that infrastructure will look like. And I think what you have planned here will maximize good investment of our healthcare dollars, because over the coming quarter century, I believe maximizing every dollar in healthcare is going to be critically important. And it's not lost on a lot of people. And while we were in Cape Breton, I think the Premier was given a disc by a nursing student, I believe, Premier, and I think she had outlined 301 ways to save money in the healthcare system. So this project is about renovation and accommodate the collaborative approach with a nurse practitioner, a family practice nurse, doctors, and other healthcare providers. So consolidating healthcare services and improving access for patients and working conditions for healthcare providers. These renovations will improve how we deliver care to meet the needs of citizens here. And I absolutely believe profoundly that the more we can do in each little community across Nova Scotia is top quality patient-centered care. And it will take pressure off the hubs, our regional hospitals, where of course we always, some of us will have to go, depending on our health requirement process. So we'll consolidate the healthcare services, improve access for patients, and the working conditions for the healthcare providers. Renovations, however, improve how we deliver care to meet the needs of citizens here. So today it really is all about you, what you've done to get this far, and the health care that will be here for you in the coming decades. There's lots of pressure on the healthcare system, as I said, and we know that how we use physicians and the healthcare system rise as the effects of the chronic illness become more pronounced with age, and it's caused us, even in the first 100 days of our government, to move very quickly. And I thought with this wonderful captive audience that I'd give you a few of those areas that we have started to prepare and to put before Nova Scotians in the coming weeks and months. So we're going to renew our nursing strategy. We've signed an expert retention and recruitment action team for physicians now, but we know that that will have to apply to many other healthcare providers. It is small communities like yours. Yesterday, actually a larger community, Bridgewater, the community of Digby, where our Premier lives very close by. He has seen Digby for one full decade with the challenge of having enough family physicians or even a primary caregiver, nurse practitioner to be able to deliver good care to that community. And they are now in the process of building a collaborative health center. And the good news about the bad news story that sometimes the press put forth is that already 3 doctors have signed up now to come to the community of Digby. And this work that will go on in your community, and maybe I'll get down. I know your MLA Lloyd can tackle the job, but maybe I'll get around for when the sod turn and we actually break ground to make your dream a reality. But that collaborative center here will become a wonderful tool to attract the next generation of doctors to your community. Now we're certainly hoping, our good doctor here today, and I did miss your last name unfortunately, but I hope you're going to practice for another quarter of a century, because I can tell your love here in this community and your work is certainly appreciated. But we also will be working to support the collaborative health teams, improve chronic disease self-management, and looking at ways to provide care to communities through technology. And technology is going to be one of those wonderful ways that will advance care, that will allow you to get care closer to home, or to get tested, or to look at how you're doing after in a post-operative circumstance. And we have already had our first day of a workshop to develop a dementia strategy. And one of the amazing things that I discovered as I entered the department was finding out the level of expertise we have here in Nova Scotia around dementia and Alzheimer's, and how we can roll out some very concrete, very specific measures to help in the home, help in the institutions, but in particular to help people stay in their home just a little bit longer and take pressure off of our nursing homes. Those are the kind of strategies that we're going to need in the coming decades. Also, streamlining the system so that we can put our dollars to improving healthcare and get them to the front line, and that's why some of the restructuring that will roll out in about a year across the province needs to take place. So we'll be putting patients, families, and individual healthcare first and foremost. So we hope to create a high-performing system, patient-centered, built on best practice, providing quality services that are appropriate, accessible, and safe for Nova Scotians across their diversity is a priority. And to finish off, I'm a strong believer in hearing your voice. I believe on most occasions, when we have a situation to deal with, the answers are in front of us. And the Premier has said this on many occasions. We will not be a government that will look very far beyond our own population to find solutions. There are experts in every room and every place where we go across this province, and we will not have to bring a lot in to do that kind of work, which in many ways is very expensive work as well. So we'll put emphasis on local management. Your community health board has to be a wonderful sounding board, the eyes and ears of health care and deficiencies that may be in your community. We want community-based decisions, and really, today, the proof is right in front of me. You are responsible for this announcement, and that's the truly good news. So the community took the lead, and in many ways, the government followed. And I think that's how we have listened to you. We'll continue to listen to you. And it's wonderful to be here on this tremendous announcement for your community. I only had a little fear and trepidation as to what the next request from your MLA is going to be. Thank you very much.
So on behalf of the Board of Directors and GASHA, I would really like to say how pleased we are to be here today to stand with Premier McNeil and Minister Glavine to announce the funding for the redevelopment of the Guysborough Memorial Hospital. The Guysborough Memorial Hospital is conveniently located to serve and meet the healthcare needs of the residents of many communities in Guysborough County. We are confident that the redevelopment will make healthcare more convenient and more collaborative as we focus on patient safety and quality of care. As we move forward, we must do so together with a vision of improving access to primary health care, where community members can receive the right level of care at the right time, at the right place, and to have access to a mix of healthcare providers and collaborative teams. During the planning phases of this project, a few years ago, when it first started, the Guysborough Memorial Hospital formed a committee to look at the hospital and its current services at the time. And from the committee came a vision for a primary health care facility as part of the hospital. The vision was for a primary health care space, offices for physicians, physiotherapy, occupational therapy, mental health, continuing care, and others, and a vision that the community members would have, you all, would have a one-stop shop where it came to their healthcare services. So this collaborative approach to health services supports the GASHA vision for healthcare and continues to move us towards an approach that is inclusive, patient-focused, and one that supports improved coordination and communication amongst hospital staff and services. Finally, I would like to recognize the hard work and the dedication and support of both the Hospital Foundation and the municipality of the County of Guysborough. I would also like to thank Elaine and the members of the hospital community for all of their work as we've brought this project to completion, or to this stage of completion.
I'd like to thank the Premier, Mr. Glavine and Mr. Hines for being here today to tell us about funding for an addition to our hospital. We could call them the three wise men, bringing gifts of gold, frankincense, and myrrh to our baby. However, we do not allow sex. So sex in our buildings will only take the gold. The people of Guysborough love and are very proud of the care on this hospital. They love this hospital and they care for it. This is reciprocated by all the workers at our complex. We are one of the most blessed communities in the province, as we have a full complement of committed physicians and availability to all of you, our citizens. No one has to wait more than a day, if that, to get an appointment. If you are an emergency, you are seen within minutes. There are no 5 to 10 hour waits in our ER. And people come from as far away as Pictou County to be seen because they know this. We have a highly trained staff of acute clinicians in our nurses and associated professionals. They are very sensitive to the needs of you, our family of patients, and they keep the doctors in line. Our motto over the last 35 years has been education. And we follow this to the letter with our constant going to courses and in-house seminars and teaching of and our exchange of mutual ideas. This edition will bring all the auxiliary caregivers and make our treatment teams stronger. There's a large area in the plans for mental health, so I want to know what the Department of Health knows about us that they aren't telling us. In closing, I want to say that we want to be the best of the best, and we hope that this edition will make us better. Thank you.
Thank you, Dr. Foley. Enlightening as always. I now ask our MLA, Lloyd Hines, to make a few remarks.
Thank you very much, Bill. And Mr. Premier, Minister of Health, platform guests, thank you for coming today. But I really want to thank all of you folks for being here at this wonderful announcement that we have here today. I want to talk to you for just a minute about partnerships. And this community is fabulous. When I say this community, I mean the greater community, all our communities. Fabulous for being caring and forming partnerships. Partnerships between neighbors, partnerships between institutions. I see recently that the Boylston and Guysborough Fire Department are forming a partnership to improve their efficiency, to get things done better. I'm thrilled to see our partners from the Strait Area School Board here today, the chair and the superintendent in particular, because that partnership created this facility that we're in here today that we're all very proud of. I know everybody here takes a bit of pride in this, and that came about because we work together with that institution. Also, of course, GASHA, working within that organization to create partnerships to make this sort of thing happen. And another partnership that was mentioned, but one that I want to particularly call forward, and you'll forgive me if you think it's because I spent 25 years with that group. Probably it is, but it's the municipality of the District of Guysborough. 5 years ago, when this was heating up pretty good, looked like a very good possibility, the council, your council, stepped forward and committed $800,000 towards, at that time, the $1,050,000 contribution from the community. And that was done unanimously and with great generosity, and I think had a huge influence in delivering this project to where it is today, because it illustrated to our friends in the provincial government that we were serious about what's going on and that we were wise and valued the importance of good healthcare delivery for our community. So I want to thank the council here publicly for that, and the warden is here, some of the senior staff and councillors. That has enabled this to happen. You know, I can remember very vividly, because 25 years ago was when this new facility that we had at that time opened. The budget, I believe, for that was a little over $6 million for the combined facility up there. And now we're talking about 5.8, 25 years later for an extension. So inflation is reality, folks, I guess. The other partnership that I think has worked very well, that is unique to some extent across the province, is the relationship between the Milford Haven Home for Special Care and the hospital. Of course, you know, those two buildings are attached, and it was, at the time, 25 years ago, the nursing homes in Nova Scotia were under the Department of Community Services, that they're now under Health, and there was a little bit of friction, I guess you might say, about making that combination. But people around at the time, including the late Dr. Brunton, persevered, and we were able to create a facility that got synergy going with those two departments, and now, 25 years later, Department of Health has the nursing homes, which is appropriate, I think. And that partnership has resulted in great health delivery, because I think everybody here knows the reputation for quality care that Milford Haven Home has, and how important it is to have that facility in our community to look after our seniors. The province has, with GASH's help and the foundation's help and the auxiliaries' help. By the way, I heard through the grapevine that the last hospital bazaar raised a little over $17,000. So thank you very much, everybody. Thank you for coming, and Mr. Premier and Minister of Health, thank you again. And we look forward to starting construction in 2014.
Thank you, MLA Hines. I will now ask the Warden of the Municipality of Guysborough, Vernon Pitts, to say a few words.
Council was of the opinion that someone has to step up to the plate first with a commitment of cold, hard cash. This would show that there's a need, as well as making a loud statement and a strong commitment on behalf of our residents, that we are willing to invest in the future of our residents as well as our communities. This will also send our doctors and other healthcare professionals a very strong message. Yes, we want you to live here. I know we can capture you with our natural beauty. That's not a problem. But we want you to enjoy going to work in an atmosphere that hopefully you all had a hand in the design. So, Mr. Premier, Mr. Minister, Lloyd, and all of you assembled here, I would like to thank the Premier for his announcement here today. I would like to thank the Health Minister, and special thanks to Lloyd. Lloyd, he hit the ground running on this one. Thanks, Lloyd. Now, let's put some fresh mortar around our community's cornerstone. Thank you.